Hello, how are you? Welcome once again back to the channel. Today we are talking about first aid. First aid that you offer to a patient, to a person before reaching them to the clinic or to the nearby hospital that is around you. So today, one thing that I want to talk about, these injuries that we see on a daily basis. These are injuries that are some of them are accidents, and some of them, yes, they can be quite scary. But there are some that we can handle in the house before we even reach to the hospital. But I want us to know how we can handle them, because sometimes we handle them. Yes, we try offering first aid, but when we reach to the hospital, you realize whatever you did was increasing the pain to the patient or to the injured person. So one thing that let's assure ourselves, let us try not to panic, because the moment you panic, your mind goes blank. When your mind goes blank, you can't think straight, you do not know what is where. That is where an African woman will leave the house without even shoes, running to the hospital. Mark you, this person can even pass the hospital because you are in a panic, your mind is not working straight. So one thing that I've been championing for and been telling my clients to be having at home is a first aid kit. A first aid kit for them, I always tell them to have an improvised first aid kit if they cannot afford a medicated first aid kit. A first aid kit, what are the contents of a first aid kit in an orthopedic area? A first aid kit in an orthopedic area should have an adhesive plaster. Adhesive plaster in my country, we'd call them elastoplast. You can get them in your local drugstores. You can also have a triangular bandage. You can also have crepe bandages. You can have gauzes. You can also have arm slings. That is, yes, you can also be having some medication like paracetamol or ibuprofen. That will be okay. So in this first aid kit, how do you know what to use where? So things to check for when you have an injured person in your house. There are some sounds that people tell me they heard when they fell, and they felt this one must be a fracture. There is that one. There is visible deformity. After the fall, you realize there is a way. The shape of your hand is not this way. Maybe it has gone inside and out, or maybe it is outside. Yes, do not call it a dislocation, because we only ascertain a fracture or a dislocation through an X-ray. An eye cannot have an X-ray. Another thing that you are supposed to ascertain is their swelling. Is the area warm to touch? When you want to know if an area is warm to touch, you touch both sides. You touch the injured side and you touch the non-injured side. That is how you know this patient has been injured and the area is locally having an increased temperature. And then there is that, when you touch the place, there is that sound. We call it crepitation. But in a layman's language, I would call it a grinding sound. You feel it's like two things colliding each other. There is that sound that you hear. And then there is a presence of a wound. That presence of a wound, you can see maybe a bone popping out, or sometimes it is actually not popping out. So another thing that you should also ascertain is, yes, I have an injured person with me. I'm in the house, or rather I'm at home. The hospital is quite far. I'm having financial constraints. How can I mobilize this person so that as much as they are lying here, I'm planning to take them to the hospital, they are in a position to not feel so much pain. So we say you immobilize. Immobilizing, some people use cartons, just a carton. You just cut a carton and then you place it on the limb, and then you can use a bandage for the upper limb or for the lower limb. Some people use sticks. Some people use very weird things. They do very weird things. So when they reach the hospital, you look at the patient and you wonder, first aid gone wrong. But anyway, you people try. I appreciate. Now, what not to do when you are doing first aid. Most of the people, the first aid that they first offer when somebody has fallen is you massage with hot water. What do hot water do to the body? You see, when you are injured, already that part is tender. It is soft. It is if you touch it, it's not like the rest of the body parts. There is a way it feels. So when you apply hot water, it's like you are catalyzing this place to have a tendency to swell. You are catalyzing this place to have an increased pain. Sometimes the swelling can be too high to a point we cannot salvage the limb. It has to be amputated. So I always say, if you don't have a fridge or you can't access an ice pack, you can also make an ice pack at home. It doesn't have to be bought. You can make an ice pack at home such that when you injure yourself, you rub the ice pack around the area that has been injured. Also, do not massage the area with these ointments, these medicated ointments. Stop it. It will do the same thing as the hot water are done. It will increase the pain, the swelling will increase, it will be very uncomfortable to the patient, and it becomes also hard for us to handle that patient because one, you can make the fracture to actually we say when we do an x-ray and we see how the fracture is looking like from an x-ray, we can tell you the fracture is stable. Stable to mean it's okay, it can just be casted without nothing, no much reduction or any minimal there is, or none at all. But when you do such kind of things, because you really massage, you displace the fracture. Displacing the fracture is meaning you remove it from the original point to another point that makes the situation worse. So you are complicating the medication of this person, or yes, you are complicating the medication of this part. And then do not apply tight immobilizers. There are people who use very weird things. In my practice, I've seen sticks wrapped with clothes. Yes, they've tried. But you see, it is so tight that by the time the patient is reaching the hospital, the blood supply has been cut off. It's like we are talking about gangrenous place, not even a fractured place anymore. It's gangrenous. And sometimes because there is a wound and we do not know how to clean it, we just put whatever we put, there is an infection that gets in. And since we did not arrive in the hospital at the right time, you realize that this person might be susceptible to so many other microbes that come. They might even end up with osteomyelitis. Osteomyelitis is an infection of the bone. And this is the worst that can happen to a person in terms of orthopedics. And avoid using the injured limb, especially if it is on the lower limbs. You can be using the walking sticks that I had mentioned. You can also be using the walking aids, the modern walking aids. And yes, if you have a suggestion that you want us to talk about, we will tackle that, or a topic you want us to discuss, please put it across. I'll be glad to read it and talk about it. Kindly subscribe to the channel to give me a motivation that somebody is out there who is really learning something. Somebody is really out there who is gaining something that they did not know they could do. And yes, keep safe, be safe. Any questions that are there, please, if you want to DM me, kindly DM me. You can write on the comments down below so that I can reach them. Thank you.